511 here on All in a Day. On a regular day, they serve as a guide for people navigating the healthcare system. They advise their clients on where to turn to for care. They prepare them for medical appointments. But with the healthcare system now dealing with pressures from COVID-19, how has it affected the work of those independent nurses who double as care managers? We reached one of them this afternoon. Susan Hagar is president and founder of Nurse on Board. That's a service which deals with healthcare navigation and patient advocacy. She's on the phone with me this afternoon. Hi, Susan.
Hi, Alan.
Well, what concerns are you hearing from the people who are reaching you right now? They must have a load of different questions than usual.
You bet. Well, it really does depend whether it's somebody that I know or like as in a patient of mine or somebody else in the community. But a lot of concern around how to care for the senior parents.
Questions like what?
Well, palliative care, for example. Can people have palliative care? Can they die at home with COVID-19? If they end up in the hospital, will they get out, or could family visit them? Those are things that people are very worried about. Also, care within retirement resident living. Who can visit? How's the care? What about physiotherapy? What about all the other services that people need? They're very worried about quality of life issues and care issues.
And we were talking about some of those concerns in the last hour of the program too. What are you able to tell people? Because obviously each person's situation is going to be different too, right?
It is. And, it's really stepping back and taking a look at what is essential for people to have. And obviously that varies from one person to another. But, we as nurses in independent practice are out there doing what we always did. And we're very careful, of course, given the circumstances. But the reality is that we still are going to wherever people are and doing physical assessments and making sure they're getting the care that they need because we can. And, we are highly experienced nurses. We've been through a lot in the last, 30-some years of our careers or more. And so we're not afraid to step in and do the right thing for these people.
Is it taking more time than usual to connect clients with healthcare services that they need now? Because, you're used to navigating the healthcare system one way. That is no longer completely the healthcare system we're dealing with.
It's so true. And actually, I'm not finding that I'm having more difficulty. It's rather interesting having, conversation today with a cardiologist, yesterday with a hematologist, actually being able to get the doctors on the phone and tell them what the problems are with the patient, and then being able to give my assessment of the situation, getting them to order tests, blood work, medications, treatments. Those things are all still going on in the background, and they're relying, of course, on the information that I can give them as a healthcare provider in the community seeing these people.
But there are some clinics that are no longer even open, right? That's got to affect what you do.
Well, it does affect the patients for sure because there's nobody actually physically seeing them. So then they're calling us, and we will go over and assess people as needed, and whether they're in their own home or retirement residence, and then help the physician who, by the way, does have a collaboration billing code, so their conversations with the nurses can be billed and should be billed because they are helping us to make sure that our patients are doing the best they possibly can. And their families are exceptionally worried because they're not seeing their loved ones. They're not sure everything is okay. And they have reasons to be concerned because there's care issues all the time anyway without this pandemic. And so there's, another level of concern. And as well, retirement residences, for example, are struggling with their own staffing issues where people are off ill, they've been exposed, they've been traveling, all the kinds of reasons that people have to stay home right now.
And your nurses, if they're out visiting households, caring for, working with patients, are the nurses voicing their concerns about doing that when COVID-19 is still spreading?
I don't think so. We have proper personal protective equipment to wear as appropriate. We're doing everything that we can. The reality is that, people are moving about in the community to the level they need to, be it grocery stores or pharmacies. And so we all have to take precautions, and then we take additional precautions in this environment. But I think it's actually safer because we know basically where we've been. We're being exceptionally careful. We're really careful to protect our patients. And obviously we don't expose anybody that we don't have to. We're not doing things that are routine. And we know our patients well, and we can often, even people we don't know that well, we can ask all the right questions to know what is something that people need to worry about. People aren't sure what to act upon. And really, we have a big goal right now. We have to keep people out of the hospital through the assessments and advice we can give. We need to manage their chronic, complex health conditions in the community, which we are trained to do. And then this sort of proactive role, a holistic one, where we're dealing with the physical problems, dealing with the mental, emotional stress of all this, helping their healthcare providers to make sure that they're still getting support. For example, with physio, we can train PSWs and other people in their care circle to continue doing things that typically a specialist, say a physiotherapist, had to do. There's a lot we can do. We are very innovative. We are used to working in unusual circumstances. Most of us have been through some unusual things that we're very creative, and we're seeing people through an extremely difficult time.
What do you think is a past experience that you have learned the most from, that you or the nurses are applying to this one?
Well, I think for myself, I've certainly worked through many situations of isolation, for example, where patients have had to be on isolation and had to be cared for in a very different way. And that really changes nursing, how we deliver care, knowing what their needs are. We're used to really assessing needs where people are in isolation, for example. And right now we've got a community of people who are in isolation and dealing with all the fallout of that. So we are, nurses now in independent practice, which is really emerging in Canada, to, for example, to be able to hire a nurse in independent practice to have a better experience in healthcare. At this time, there's a lot of change happening, and so we're used to seeing people through these changes. An exciting initiative that's just come out, and some of the nurses involved are in independent practice, is a new prevention and management of skin damage that's related to this personal protective equipment. So basically how to protect your skin. And so there are nurses in the community that are working day and night to get this out there for all the people who are having to use this protective equipment, because that's a big issue for us. So we're all working in the background. I honestly believe that with all the trouble in healthcare prior to this pandemic, that as the largest body of regulated health professionals, we are the solution to the problems in community care now, before this pandemic, and going on from here. I think people will understand this unique and important role that we're in.
I mean, that skin example is one that I'm sure not necessarily a lot of people are paying complete attention to, and so getting attention to that must be important.
Yeah, I think so. I think nurses have always been here. It's kind of interesting that 2020 is the year of the nurse. Yeah. It's like somebody knew that COVID-19 was coming down the pipe, because obviously nurses are on the front line. And here we are in the community as well, really trying to keep people away from the hospital. And, in retirement residences, we're really having to stick handle that because, this idea of the hospital being the backup plan for every little thing that comes up in a residence, that's not a good idea. It never was, and it certainly isn't now. And so, we posted something recently about how do you keep your loved one out of a seniors care facility, and, calling them once or twice a day to be really clear on their symptoms, making sure every caregiver hand washes before they touch them. And every sign in the world won't make that happen. It's a person saying to them. So we've been giving a lot of tips in the community to help make sure that people are as safe as they can be.
Susan Hagar, thanks for what you and your teams are doing. I know it's also a cost on them too, mentally and stress-wise and emotionally and fatigue-wise too. So thank you for what your teams are doing.
Well, absolutely a pleasure and great talking to you. Thank you very much.
Susan Hagar, founder and president of Nurse on Board, a nurse-led healthcare navigation and patient advocacy service.